Well, the definition of glaucoma is progressive damage to the optic nerve of the eye. The optic nerve acts like an electrical cord with about 1.2 million nerve fibers. It's responsible for sending an image from the eye to the brain. So it's responsible for vision. And with damage of the nerve fibers, the image will not get to the brain. So a certain area of the retina will have a blind spot. We don't know the exact cause in most cases. But we know that there are a certain amount of risk factors. The main risk factor is the pressure of the eye. We know that when the pressure is high inside the eye, there's a higher risk of getting glaucoma. Other risk factors are age. Over the age of 65, you have a higher risk of getting glaucoma. Being of African heritage gives you a higher risk of glaucoma. Diabetes is another risk factor, smoking, etc. The sneaky thing about glaucoma is you can't feel the symptoms. So you do need to go to an eye doctor to have it tested. That's the only way you can have a thorough examination and we can check you for glaucoma. So if you are of African heritage, especially over the age of 40, you should definitely come for a checkup. If you have close relatives, family members with glaucoma, you should come for a checkup. If you're over the age of 65, if you have diabetes, if you're a smoker, all of these risk factors, you should definitely come for a checkup, and from there we will decide how often we need to see you back.
After doing research and certainly talking to the doctors here, I now know that glaucoma is a hereditary disease. I'm not aware that anyone in my family, my immediate family, my mother or my father had glaucoma, but then in those early days, testing was not as prevalent, and people just assume when you reach a certain age you were going to start to lose your eyesight. So it's quite possible it was there, but they were never tested for it. I now know that my children need to be aware of the fact that I have glaucoma and the fact that it is quite possible that they may also suffer from the disease later on in life. So it will be important for them to become tested. My youngest son, my youngest child, is 19 years old now, so it's a little bit early for testing, but certainly he will need to know that later on. And he's certainly aware of it now because when he's home from school, he always reminds me, "Dad, have you taken your eye drops?" Or sometimes he will even assist in putting the eye drops in for me. So there is that awareness there. What we really need now is we need for the wider public to be aware of glaucoma and its effects. And I see it quite constantly when I go to the eye clinic. You see how many people are there, for other eye diseases as well, but in particular glaucoma.
And like I said, glaucoma is a progressive, irreversible disease. So the earlier you catch it, the better. You can preserve more vision. If you catch it early on, you can treat with pressure lowering eye drops, which will hopefully halt the progression. That's the goal anyway. You can't fix what's already damaged, but you can stop the progression.